be talking about the calcaneus bone. So the calcaneus bone is the largest bone in the foot. As you guys may call it, it is known as the heel. Also important to know that the calcaneus has 4 surfaces. So this is your, let me get my pointer. It's right here, would be your superior view. So this would be your superior surface. In your superior surface, you have, or you can see your sustentaculum tali. You have the articular surface that is going to articulate with the tailor. So it's called the posterior talar articular surface, right here. And you have another talar articular surface known as the anterior. So obviously, right, that's why you have 2 talar articular surfaces on the superior surface of the calcaneus, because you have one anteriorly and one that's posterior to the anterior surface, to the anterior talar articular surface. You also have a third talar articular surface right here, the middle one. So on the superior surface of the calcaneus, you have your 3 surfaces that articulate with the talus, anterior, middle, and posterior talar articular surfaces. Moving on, you have your, this is the inferior view, right over here. This surface is going to articulate with the cuboid bone. Of course, although this is the inferior view, this is going to be more anterior or distal, and this will articulate with the cuboid bone. Here again, you see sustentaculum tali, that you can also see here from a different view. Under it, or depending on how you're looking at it, this is on the inside of it. You have the groove for the tendon of the flexor hallucis longus passing through it. You also have your calcaneal tubercle right here, and your notch is right here. You also have a medial and a lateral process, and a calcaneal tuberosity. So moving on, you have your lateral view of your calcaneus, your lateral surface. You have your attachment of the calcaneal fibular part of the lateral ligament of the ankle joint. This also has another name, I believe. Yes, this is also your peroneal tubercle right here. And then we have the fibular trochlea located right here. And what else do we have? Our lateral process. Our calcaneal sulcus is here. And what else do we see? Remember, medial talar articular surface. So because you have 4 surfaces, you can see a lot of features from different surfaces from different views, of course. So our 3 talar articulations, you can see those right here where they would articulate. And yeah, that's pretty much it for the lateral side of the calcaneus. And lastly, we have our medial side of the calcaneus. Immediately, you see your sustentaculum tali under it, which is where the flexor hallucis longus would pass under. The tendon of it would pass under it. Again, your posterior, middle, and anterior talar articulate surfaces. And anteriorly, you have, or distally, you would have your articular surface with the cuboid bone, the surface that would articulate the cuboid, and here you can see medial process, and here you can see the calcaneal tubercle, which you can see better here inferiorly on the inferior side. Okay, so those are all of the surfaces. Just something I want to point out. You have your retrotrochlear eminence, which would be posterior to your peroneal tubercle here. And you have your trigonum plantar right here. Okay, and we can briefly talk about some of the attachments. So superiorly, this is the posterior side of the calcaneus. You have your Achilles tendon or trigonum achilleum, which is going to attach to the superior 1/3 of the posterior surface here. The middle 1/3. Oh, I apologize. The Achilles tendon is going to insert on the middle third, right here, and the inferior third of the calcaneus on the posterior side is covered by a fatty heel pad. And we can briefly talk about the blood supply of the calcaneus. So we have your medial calcaneal arteries that will provide vascular supply. So that would be around here. Obviously, this is your lateral side. You can see calcaneal branches here on this medial side here. And you have your lateral calcaneal arteries. So that would just be over on this side also. You have an anastomosis between the medial and lateral calcaneal branches. So honestly, that's just referring probably to these branches here. Here you have an anastomosis between the posterior tibial and fibular arteries. You also have contributions from lateral tarsal and the medial and lateral plantar arteries. So lateral tarsal is right here, which comes across the dorsum of the foot, but it's still, it's technically contributes to the calcaneus because, of course, you have all these anastomoses going on, so they, provide contribution to vascular supply for sure. And you have your medial plantar artery going in the plantar direction ventrally, and you have your lateral plantar heading in that same direction, which also provides vascular supply as well. The innervation of the calcaneus, we don't have a picture for the nerves, but it is innervated by branches from the tibial, sural, and deep fibular nerve. So don't forget that the calcaneus has those innervations. And for ossification, it's the only tarsal bones with 2 ossification centers. So the first primary ossification occurs in between the 3rd and 6th fetal months, and you have your secondary ossification center that comes later. But essentially, the secondary calcaneus ossification appears around ages 6 to 8, and it fuses completely between ages 14 and 18. And that, my friend, is all we need to know about the calcaneus.